Well, hello, kinesiology students. Mr. Krente here, and this is a lecture on the skeletal system. We are looking at the bones of the body, and it'll be a multi-part series. And I'm going to go through the diagram here on the screen behind me and highlight the bones that you need to know. You'll note that there are some parts that are blacked out, and those are bones that you'll probably study in first year university, but they're not bones that we're going to cover in this course, or bone landmarks that we're going to cover in this course. So just so you're aware, but I'm going to go through the bones and some very prominent bone landmarks that you're going to need to know for your future quizzes, tests, and exams. Couple of things as you study the skeletal system. One is just to make sure that you are constantly reviewing and keeping yourself updated. Again, use that 20 minutes a night to keep yourself fresh on the skeletal system. Make sure that you are memorizing, cover up the different words and then be able to fill them in. And your body is a textbook in itself. You can palpate a lot of these bones that we're going to be talking about on yourself. So if that helps you, then feel free to do that. So I'm going to jump in. Are you ready? Here we go. So the first bone we're going to look at here is the frontal bone. The frontal bone is a bone of the skull. It's pretty straightforward. It is the bone that's most prominent there on your forehead, on the most anterior side of your skull. This is your frontal bone. You've probably heard of the frontal lobe of your brain, and that's where your frontal lobe is of your brain, helps you with decisions and whatnot, but that is your frontal bone of your skull. The skull is unique. It's a series of flat bones that have those sutures in them, and they are going to be those bones that are not going to move. So it is fixed there, and that is your frontal bone, right on the front of your forehead. On the side here, on the lateral side of your skull, on either lateral side of your skull, you have your temporal bone. Your temporal bone is just to the, maybe a little bit superior of your ear, and it is right there on either side. If you kind of have that, head massage, you have that idea of where the temporal bone is, or if you've heard, getting knocked in the temples, that is your temporal bone. The reason why it's called that is it's your temporal bone right there on either side. Fairly thin, but it is another part of the flat bone structure of your skull. So on either side, you have that temporal bone. This is a facial bone right here. It's your zygomatic bone. Okay, right here we have your zygomatic, and it is going to be your cheekbone. Okay, another word for your zygomatic is your cheekbone. So the zygomatic is that most anterior part of your face where you have those very prominent cheekbones sticking out. It's called your zygomatic, and it has sutures. We'll look at the skull in more specific detail later, but it is separate from the skull itself, and separate also from the maxilla, which we'll look at in a second. So the zygomatic starts at this suture here and all the way down to this suture here, and that is your zygomatic bone. You next, on your face, we have the maxilla. Okay, the maxilla is that upper part of your jaw where your upper row of teeth would be, or where your mustache would be. That is your maxilla bone. Okay, your maxilla bone. Just inferior of your nose, of the nasal bone here, which you don't have to worry about, but the maxilla is this part right here. Your teeth are set into your maxilla, the upper row of your teeth, and it is a very prominent part of the face, especially of the mouth structure. Inferior of the maxilla, you also have the mandible. The mandible is the jaw. So the jawbone is your mandible. Oops. The mandible is that movable part of the facial bones of your skull where you are going to obviously talk, chew, and it is located, it's going to be articulated to your temporal bone, actually. This is called your temporal mandibular joint. So right beside your ear, you have that movable part. If you open and close your mouth, you're going to feel the movement there at your mandible and your temporal bone, at your temporal mandibular joint. So that is your mandible. Very, very strong bone, actually. It's pound for pound. It's not the largest bone in your body, but it's one of the strongest, if not the strongest bone in your body. Because of all the chewing that you do, you actually strengthen that bone because of the weight bearing exercise you do when you chew. It actually strengthens that bone very, very well. And so those are some of the face, and we'll get to the posterior side and more of the skull a little bit later. Jumping down inferior to the next bone is the clavicle. So the clavicle is your collarbone. Right here on the superior part of your torso, you have the clavicle, and it articulates from the top of your rib cage, your manubrium there, and it's going to articulate all the way to the scapula. So that is your collarbone. It's involved with supporting your arm, especially when you are raising your arm. It is really a prominent part of that movement, and you are it is moving along with that movement there. Okay, so when you're extending the arm, so it is easy to break. A lot of people have broken their collarbone, especially when you have a blunt force here and the arm up. It's a easy one to break or dislocate, and it's located on either side of your chest. So we have clavicle there. So clavicle, collarbone, pretty straightforward one to remember. Next, going inferior, we have your manubrium. All right, your manubrium. Your manubrium is the structure where that begins your sternal body. So this entire structure right here is called your sternal body, and it's broken down into three parts. The first part being your manubrium. So right at the superior part of your sternal body, you have your manubrium, and very strong structure, very strong bone, and your first rib is going to be articulated to your manubrium. Going inferior, you also have your sternum proper. So your sternum itself is going to be here, and it is that breastbone, okay, right here in the middle of your chest. So your manubrium has a bit of a notch right at the very top. You can palpate, you can feel a little bit there. And then that really solid part here in the middle, going inferior, is your sternum. Very strong part. We want to protect our lungs, our heart. And so it's a very strong part of that. And then the xiphoid process is the third part of your sternal body. So you got your manubrium, your sternum, and then the last, most inferior part is your xiphoid process. If you feel right at the very bottom of your breastbone there, you've got that xiphoid process, and you can feel it kind of sticking down just below. It's a kind of feature that kind of points a little bit prominently just below your sternum here itself. So that is your xiphoid process. And now you have another X word for your Scrabble games too, xiphoid. So xiphoid process, sternum, manubrium, make up your sternal body. Now I've included here, this is not a bone, but the costal cartilage. Okay, these structures right here, it's kind of lighter in color. It's hard to see here maybe on the screen, but it'll show up on your diagrams and on the webpage a bit better. There's a much lighter color here that's articulating to your sternal body, the different parts. And these are not bones, these are cartilage. So cartilage is that flexible, collagen-filled material that we talked about, that's like in your ears, that is not actually bone, and it won't become bone for you. It is a flexible part of your chest. The reason that I'm just making note of it is just because you have it there. It's not bone. It features very prominently. Some people get confused and think that's bone there, but you can see where the line ends of where your costal cartilage begins with your ribs. And we'll talk about your ribs in a second, but just note that that costal cartilage is not bone, but it is kind of prominent there. And you can see why. When we breathe heavily, our chest expands and contracts, and we need to have a little bit more flexibility, and cartilage gives us that little bit more flexibility to expand and contract our chest cavity. So it's really well designed there. So I'll jump over to the ribs, the 12 ribs. You have 12 ribs on your body, and starting with the most superior rib, we number your ribs. So your ribs have a number. Make sure that going forward, anytime you are labeling the ribs, you don't just say ribs in general, you are going to label them by number. So a lot of these bones have a number attached to them, and when they have a number, you use the number, okay? So ribs are one of those. The most superior rib is rib number 1, okay? So rib number 1 is the most superior rib, and it articulates to your manubrium. It also articulates on the posterior side, we'll talk about in a second, to your first thoracic vertebrae. So all your thoracic, you have 12 thoracic vertebrae, and your ribs all articulate to the 12 thoracic vertebrae. So rib number 1. And then we go superior to inferior, and we begin to label the ribs going down by the next number. It's pretty simple. Number 1, rib number 1, and then going inferior. Rib number 2, rib number 3, rib number 4, rib number 5, rib number 6, rib number 7, rib number 8, rib number 9, rib number 10. It's hard to see here, but there'd be 2 more on the posterior side, number 11 and number 12. Okay, they'll show up a little bit more prominently on the posterior side. So we have 12 ribs in total. We have 7 true ribs. So we've got 1 true rib, 2 true ribs, 3, 4, 5, 6, and 7. The reason why they're called true ribs is because they have a direct articulation to the sternal body. Okay, so they have a direct articulation to the sternal body itself via the costal cartilage. Your 3 false ribs, so we've got false rib here, here, and here. So number 8, 9, and 10. 8, 9, and 10, they have an indirect articulation to the sternum. So they kind of articulate to rib number 7. Number 8 articulates to rib number 7, number 9 to 8, and number 10 to number 9 here. So these next 3 are called false ribs because they have an indirect articulation to the sternum. Then you have 2 floating ribs. They're kind of hard to see. They're more posterior here. And they are called floating ribs because they have no articulation to the costal cartilage on the anterior side. They have no articulation to your sternal body at all. They articulate to your thoracic vertebrae, but not to your sternum. So they're called the number 11 and rib number 12 are called your floating ribs. But make sure you know the ribs are numbered 1 to 12, okay, not 1 to 7 true rib, not 8, not 1 to 3 false. It's 1 to 12, and we just know the first 7 are true, the next 3 are false, and the next 2 are floating. Okay, so that is your rib cage. The other part here that is on the chart so far is the humerus. So the humerus is the long bone in your arm, and we have talked about that before. Funny bone, humerus, ha ha ha. So your humerus is that classic long bone. It's got a very round head on the proximal side, and on the distal side, it has a prominent feature there that articulates both to your radius and to your ulna. So this is your scapula here. We'll talk about, We'll talk about your scapula in a second when we get to the posterior side, but your humerus articulates to your scapula and to your radius and to your ulna. So your humerus. Make sure you note the spelling. It is not like the ha-ha version of humerus. Okay. So we're going, continuing to go down, and we'll go a little bit more distal here. So you have your ulna and you have your radius. Okay, these are the two bones of your forearm, and the bones of your forearm are kind of unique. Those two, when you supinate and pronate, they're actually able to turn over each other, which is kind of unique in your skeletal structure. So they actually will turn over one another when you do supinate and pronate. But of course, when we are supinated, just like we are in the anatomical position, the ulna is on the medial side. Okay, the ulna is on the medial side. So it is going to articulate with your basically your pinky side of your hand, right? And it's going to run all the way down the more medial side of your forearm. So that is your ulna. One thing I think about is you think medial has fewer letters than lateral, and ulna has fewer letters than radius. Ulna is on the medial side. Your radius is on the more lateral side, okay, and it is an articulating bone more to your thumb, right? So your thumb side, you have your radius, and your radius is lateral to your ulna. If you ever take your pulse at your wrist, you press it just under your thumb there. That's called your radial pulse. That's another way I help myself remember this, is my radial pulse is on the thumb side, so this is my radius. Now we're jumping into the pelvis here. The pelvis has a few different structures, and we'll look at some of them, but we have to look at the pelvis itself to see all of them. This biggest, largest part of your pelvis, the big wide part, is called your ilium. Okay, your ilium is this very wide, prominent part on either side of your pelvis. Very, very large and prominent part. So ilium there. Now, looking at the pelvis, this is a separate bone. It's actually part of the spinal column. This is a bone called your sacrum. Okay, your sacrum is kind of like it's like four vertebrae that were fused together at the base of your spinal column, which we'll look at the posterior side. But it's almost the very base of your spinal column. You're going to have one more, but your sacrum is right there. You can see these foramen or holes in the sacrum itself. There's four of them on either side. And when your spinal cord comes down to your lower body, we want to send nerves out to your legs. And so many of your nerves go through the holes here, the foramen of your sacrum, and they are going to provide that nervous impulse down the lower part of your body. And it's a little bit of protection, pretty well designed to have those openings there to allow that spinal cord to come through. Looking at the hand here, so switching over, we're looking at the hand structure. We are looking first at your wrist bones, and collectively, your wrist bones are called the carpals. Okay, your wrist bones are called the carpals. There's a series of 8 of them. We'll look at in more detail a bit later. You're going to know all 8 in this course, but collectively, these are known as the carpals. Right here, the base of your wrist. Your metacarpals, okay? Your metacarpals, they are going to be more distal, and they make up the palm of your hand, okay? So the palm of my hand is going to be where my metacarpals are. So these long bones that are, there's 5 of them, they are represent each finger. Those are your metacarpals. And your metacarpals have a number, just like the ribs have a number. And it's pretty easy to remember if you remember this one thing, because this follows through with your phalanges as well, that 1 is thumb. 1 is thumb. And so number 1, metacarpal, number 2, number 3, number 4, and number 5. So each metacarpal has a number. 1 is thumb, number 2, number 3, number 4, and number 5. We'll look at that in more detail when we look at the hand. Then you have your phalanges. So your phalanges are the technical term for your fingers. You have your phalanges are numbered as well. Again, 1 is thumb, phalanges 2, 3, 4, and 5. And there are in 2, 3, 4, and 5, there are 3 bones there. You have a proximal, a middle, and a distal phalange in each finger, and then your thumb just has a proximal and a distal phalange. Okay, so we'll look at that in more detail when we look at the hand. Moving down to the legs here, we have the largest bone in your body, the most prominent bone right here is your femur. So the large bone that makes up the more distal part of your leg, that is your femur. Huge, huge, long bone, pretty hard to break, although it does happen. But that is your femur. Very, very prominent long bone. And it's going to run all the way from the large opening, the acetabulum in your pelvis, and run all the way down to your knee where your tibia is. So that is your femur. More distal, we have your patella. Your patella is that knee bone. It's that sesamoid bone that's kind of floating around in your knee, the top of your knee. It's really protecting the 4 ligaments in your major ligaments in your knee that allow your knee to move, and it's a great protection right there. The patella is a sesamoid bone, so it's floating. It's not actually articulating to any particular bone itself. And you can tell that if you kind of straighten your leg and relax your leg, it's hard to do here with me, but you can actually move that patella around if you kind of straighten your leg and relax it, extend your leg, relax it, and then you can actually kind of move that patella around. It's kind of weird, but it just shows that it is a sesamoid bone. Okay, more distal here, we have your tibia. All right, your tibia. Your shin bone. Your tibia is essentially your shin bone, and it is a long distal bone in your lower leg. It's going to articulate to your femur here more proximally, and then all the way down to your tarsals at the more distal end. So this is your tibia. Very prominent. You can feel it really easily on the front of your shin. Easy to bang in the middle of the night, of course. It is a very long, narrow bone here, but it is the stronger of the 2 bones in your lower leg. The tibia is that more medial, long bone in your leg, in your lower leg, in the more distal part of your leg. So the tibia is more medial. The fibula is more lateral. Okay, the fibula is more lateral. It is much smaller, much weaker, and it's hard to feel because usually you have your peroneus longus muscle there covering it, and it's much harder to palpate. So, but it is there and very much a support to your lower leg. All that force when you jump, when you land, goes through your lower leg, and it needs that support. So that's your fibula. And again, a way to help you possibly remember this, the tibia is more medial, and medial has less letters. Tibia has less letters. Fibula is lateral. Lateral has more letters, and fibula has more letters. Now, don't make this classic kinesiology mistake. Every year I get students that call this a tibula and call this a fibia. It's so easy. I don't know why they did this, but it's so easy to mix those 2 terms. But please know that the more medial bone is your tibia, and the more lateral bone is your fibula. Heading down to your foot, you have in your ankle, you have a collection of bones called your tarsals. Your tarsals are like your carpals. Don't mix up those 2 either. So in your ankle area, you have your your tarsals. So it's a series of 7 different bones that are going to make up your tarsals, and we'll look at those more specifically when you look at the foot. Okay, just remember foot, tarsals, right? Foot, tarsals, and then you have your carpals in your wrist. Your metatarsals are next. So just like your metacarpals, you have your metatarsals, and those are the bones that make up the most prominent, longest part of your foot. Just like your metacarpals, your metatarsals in your foot have a number attached to them. So the big toe, your big toe is the captain of the toes, and the captain of the toes is number 1. So your big toe is 1, and then we go more lateral. So it's metatarsal number 1, metatarsal number 2, number 3, number 4, and number 5 on your baby toe there. So metatarsals on your foot. And then your toes themselves are called phalanges as well. They are the same name as your the phalanges in your hand. It's just the phalanges of the foot. So the phalanges of the foot are numbered, just like I said. The big toe is the captain, number 1, and you have phalange number 1, 2, 3, 4, and 5. And just like in your hands, you have in numbered in phalange of the foot, number 2, 3, 4, and 5. You have 3 bones, a proximal, middle, and distal. And then in the number 1, the big toe, you just have 2, your proximal and your distal bone of the phalanges of the foot. The talus here, the talus is one of your tarsals. So it is one of your tarsals. We'll look at that more specifically a little bit later, but it is articulating to your tibia directly. But it is one of your tarsals. It's not a separate bone. So that is the the anterior side of the skeletal system, and we'll see you on the posterior side.